Hi class, Dr. Walters here. Just wanted to offer you a short focus video again, as I promised, just like in Module 5. Hopefully this is helpful just to guide your studies and give you some ideas of where to start and prioritize your time. All right, let me share my screen. So as you will know, this week is surrounding neurotransmission. So one of the first things that you want to focus on are specific anatomy and physiology, pathophysiology that is involved with neurotransmission. I want to note that Stalls is an amazing book, and I think you'll find it very easy to maneuver through the material. And they go over a lot of these key concepts right in the beginning there. So make sure you're reviewing synapse, the receptors, all of those. Make sure that you have a good idea and a grasp of how they're functioning. And then when you break down the synapse reset mechanisms, make sure you understand the differences in those and what's happening, because a lot of different drugs are associated with different categories and how that's resetting. For instance, with downregulation or upregulation, reuptake, things like that. Make sure that you understand the differences in those. And then next on the focus document, I have intoxication, withdrawal, efficacy, and severe side effects. So with those, note the inverse relationship. So for instance, everything is at baseline. We want to start at baseline. But if someone is taking a drug, whether it be recreational or if it is something within their treatment plan that we've prescribed, that is going to bring them up here, especially if we're treating something like depression, something like that. And then, so their baseline's here, then they're intoxicated up here at this point if it has raised to that level. And then the opposite of that is going to be withdrawal. So that's below that baseline. So you want to know that there's always an inverse relationship between that. So everything that goes up has to come down. So also note that we could be treating somebody in the opposite direction. So for instance, if someone is depressed, we want to bring them up to here for baseline. So again, just note the inverse relationship there. The same goes for efficacy and severe side effects. So the more intense a drug is to the point of what we would say working, for instance, then the more side effects they're going to be. So the more targeted a drug is on something specifically, then obviously, again, it's going to have an inverse reaction, an inverse relationship with something else. So there's going to be some side effects. So just note that when you're going through some things. And then that brings us to making sure you know your categories of agonist, partial agonist, antagonist. Make sure you know the differences in those. And again, this document is not all-inclusive, so you may need to add some more information into this note. I just wanted to give you an idea of kind of where to start. So next, you're going to see enzyme target receptors, G-link proteins. The table 2.4 in Stalls is an awesome table for you to look at those proteins that are related to specific neurotransmitters, and it's broken down in that way. Okay, next, I moved straight on to some neurotransmitters. I noted some very important ones here, but again, just ones that I wanted to highlight that you're going to see very, very often in psychiatric care. Again, this is not all-inclusive, so you do need to be looking at the other ones there, but I just wanted to point out some major things here. You do want to know, is it excitatory or inhibitory? Again, which category does that neurotransmitter fall into? And then what's their function? What are you seeing occur? What's associated with that specific neurotransmitter? So for instance, for serotonin, I made some notes here. We've got depression, obsession, migraines, anxiety, intestines, and nausea. So how are all those symptoms involved in serotonin? And then you're going to see the raphe nuclei. You need to know where these neurotransmitters, specifically to the pathophysiology and the anatomy, where are these organically occurring. And so then I have dopamine. I also included a few others on here. You may want to add some more on here. There's some great charts installs, and I know last in Module 5, I offered you a link that had a chart on there also. I think it was within one of the discussion boards. I can post that again. And it also had a link to a video for memorable psychopharmacology, memorable psychiatry as the author. Again, they just kind of cut through and give you some very basic and clarity to the topics surrounding neurotransmitters. So next on the focus document, I put some information related to metabolism and maybe some genetic issues that might be involved in that, how certain people are going to metabolize certain drugs differently. So I just gave you some ideas here of what you need to be noting when you're taking notes and when you're researching and looking at everything. You're going to see P450 highlighted pretty often because that deals with metabolism within the liver. And we know that a great many drugs are going to pass through the liver. So you want to be noting how people are metabolizing associated with those specific drugs. Are they inhibitors? Are they inducers? So you want to know which drugs fall in which category. Within clinical practice, we would want to make sure in a history that we are noting any history of liver disease, kidney disease, and family history as well, so that we can be aware of that and maybe try to steer clear of some drugs that would be associated with bringing someone to toxic levels if they're not metabolizing very well, or that we can just be on the lookout. A couple others that I put in here just for your own research that you're going to want to look at, the HLA-B, 1502, and MTHFR. FDA actually requires testing for anyone of Asian descent for some specific drugs. Put that on here for you to just note. Also, because of the risk factors associated with Stevens-Johnson syndrome and TENS. Again, you just want to be aware of some of those things. And then MTHFR, a large percentage of the population will have this specific in their genetics. If you do any testing, you're going to see this pop up. It deals with detoxification of the body. And they may need to be put on methylfolate just to help them rid their body of toxins and different things of that nature. So lastly, I put on here, know your normal values, CBCs, electrolytes, all of those things. Depending on where you've worked previously as an RN, I know you all learned this in your RN program. However, some of us will be viewing labs on a daily basis where some of us in other units haven't done that. So just refresh yourself so that you know where those normal lab values should fall, because lab values are going to be very, very important when you're choosing a drug to prescribe in a specific treatment plan, or if you're trying to find out why is this not working for my patient, what is happening here. So again, just a little tip for you to be aware of. So lastly, for a study tip, I'll try to give you a new one each week. So a different way that I studied aside from the index card tip that I gave you in Module 5 was to make concept maps. And I should have thought to have one pulled up for you. I think I may have mentioned that last time as well. but you will put, if you didn't do this in undergraduate, then you'll actually put the key information there in the middle, and then you're going to have branches coming out from that with little bubbles. So for instance, you may choose a neurotransmitter, serotonin, and then the first little bubble from that is going to be any symptoms associated with any issues with serotonin. So if there's an increase in serotonin, what's going to happen? If there's a deficit, what are you going to see? Okay, and then you may have another bubble that says these drugs are associated with serotonin. Specifically, these address a deficit. So just a different way that you may approach studying. Find what works best for you and stick with it. And then if there comes a point that that's not working, then switch it up. But I thought I'd try to offer just some different ideas that sometimes we are just so concentrated and focused on, okay, I'm just going to read the material, make an outline, read the material, take notes, that we just don't think of other ways that may help. So sometimes brainstorming and kind of having that little map in front of us that gives us little bubbles, we can cluster the information into groups so that we can learn the material a little quicker and make it move from short-term memory to long-term memory in a different way. So again, I hope this is helpful. Please let me know. I will be looking at the discussion board for any specific questions that you have related to this week, but I just wanted to give you some key things to kind of focus in on and just start your studying with. Again, disclaimer, this is not all inclusive of what you should be studying. However, I hope this helps you just prioritize and give you an idea of where you should be moving through the material. So have a great week. Reach out with any questions, and I will talk to you soon. Thanks.